We are confronting a situation that humanity has not faced in the last 100 years. The COVID-19 pandemic has thrown most countries, including ours, into an unprecedented health and humanitarian crisis. At this time, hundreds of non-governmental organizations have come out to help the poorest and the most marginalized citizens of the country that are affected in this pandemic. In today's session, we are joined by Ms. Nivedita DasGupta, Country Head of Miracle Foundation India, to talk about the role of her organization, to talk about how NGOs have emerged as pillars of support, and to discuss the need for a new social contract for the coronavirus. Ms. DasGupta, welcome. For our viewers, could you share the role of your organization, Miracles Foundation, and the initiatives you have undertaken during the time of COVID-19?
Sure. So Miracle Foundation has been in existence since 2000. We began our operations way back 20 years back. The primary aim and vision of our organization is that we are supporting orphans and vulnerable children to have a better quality of life, while we are trying to bring about sustainable changes that will reduce the need for institutionalization. So part of that, we build capacity of the childcare institutions, to whom I'll refer as CCIs henceforth, facilitate and conduct training, and also partially fund, so that the standards of care or the rights of the child are fully met. That's what Miracle Foundation does. We have a presence in 7 states where we are working with several CCIs, and we are in another 4 states where we are supporting and training government officers through a UNICEF project.
Right. And can you share with us how much funds you have raised so far and how you plan to spend it on your initiatives in these 7 states?
Yeah, so let me just go back, because these CCIs, when this pandemic broke out, a lot of them, they're in 7 states, as I told you. A lot of them faced a problem where either the local government who governs the childcare institutions, it's called a district child protection unit, part of the Women and Child Development Department, or the Child Welfare Committee gave guidance to the CCIs to send the children back to the families or relatives wherever it was possible. In many cases, the families also came forward to take their children back. And you would have seen even now, the migrants are wanting to go back and join the families. There's nothing, weird if the families wanted their children back. So when this started, the children started going back. But immediately we started getting a feedback from our partners saying that the families are really suffering because there is nothing to eat. Because most of their parents, and in general there are single parents and mostly single mom, they had lost their daily wage jobs. And there was a crisis of, actually providing food. So at this time, Miracle came forward and decided that the best way to help them is with immediate emergency relief, is to give them, support them for the basic groceries and hygiene items. We knew that the children are spread across each CCI into the interior areas, and with the lockdown, it was not possible to go and give these relief packages. But fortunately, our CCI partners found everybody's bank accounts, all the parents. And we managed to do a bank transfer to each of these families. And it was wonderful that it went so much in time. The minute the money was transferred, within a day, the parents had withdrawn it. They had bought the groceries, and they reported saying that they have now something to eat. So that's what we did. And we will continue to do that for 2 more months to support them. If it is required, we'll continue to support them beyond that, depending on the situation. Apart from that, the other support which immediately the families and the children who went home was required was for psychosocial support. Many of them were, suffering from anxiety, suffering from, just sheer, inability to understand what's happening and whether their education would continue. That's where the second support we built in through phone to support them. You asked me about the funds that we have raised right now. We are at it right now, continuously raising money for it. So far, we have raised about 85 lakhs, and we have a long way to go. We have been appealing and applying everywhere. There is a good opportunity and encouraging feedback that we get from corporates and other donors, because people do want to come forward and support. And what better than support this vulnerable category of children and their families. So that is where we are. Currently, we are supporting about 1,600 such children and families. We have taken an average of 6 per family. So that's what currently we are looking at right now.
Yeah. So before I move on to my other questions, I would like to know from you how viewers can contribute to your organization. It's a noble cause, I'm sure. There will be many who would like to contribute. What is the process?
So process is, this is per child or per family. It costs only per month, only 3,750 rupees. And a support of 2 to 3 months is something which is substantial. And for the viewers, the information that I really like to give is, this money gives them opportunity to buy either wheat or rice, 10 kilos, dal, oil, milk, vegetables. These are the basic necessities, depending on rice and wheat, whatever they want. It covers the hygiene products such as bath soaps. It covers the female hygiene products if there are girls. So that's what the package covers, and some vegetables, of course. As I said, the cost per child or per family, 3,750. Anybody going to our website, www.miraclefoundationindia.org, you will see this information there, and you can click and donate there. That's the best way to do it, and the quickest way to do that.
Right. Thank you for sharing those details. I would encourage all our viewers to make whatever kind donations that they can. Moving on with the discussion, where you said that there are families, roughly, I think, 1,600 that you're catering to right now. But in reality, the number is in millions, right?
Yes.
There are millions of destitute children and parents across India. How do you select? How do you choose which ones to be given this priority or this benefit?
So we have primarily gone through our partners. As I told you, we work with the childcare institutions, and we have selected children from the CCIs who have gone home right now. So that's how we have selected. Because through the CCI, we know the families, we know the children. We are able, and it's not a question of giving them that aid or that emergency relief. We want to monitor it. We want to mentor it. We want to see how that money is used. And it's not just for food. We're going to support, because this is a problem which is going to continue. The children, whether they'll come back to the CCIs in time for education, or they'll be there with the families for long, or may not come back. They may choose to stay with the families. Then what happens to their education and other needs? So we are looking at it as a long-term and a completely comprehensive plan to support them. That's how we are looking at it. So working through the RCCI partners to select these children, we thought was the best way to do it, because we do know every child, every family, and we have their individual childcare plans in place. So based on that, we are able to work with them long term.
Right. And apart from these comprehensive plans and whatever is already on the field right now, the kits that you've provided, the rationing that you're providing, education is also an important factor for children, especially when schools have been shut for the longest time now. In this regard, how is Miracle Foundation aiming to help students and children, especially in rural areas?
Certainly. Yes, it's a challenge, but it's not impossible. What we have realized, and we have been talking to various state education departments and other NGOs who are working in the field of education. There's a lot going on and a lot being planned on remote education. So we are in touch with them to see what is the best possible solution and how these children could benefit. We ourselves are looking at partners with such agencies who could help us to take the education forward. We are also looking at supporting children through giving them smartphones so that they can continue their education forward. There's a lot, and some of them are already doing it. So we were encouraged by this, that if our classes could be held on the smartphone, why don't we try that? So we want to do that. The biggest support we also gave apart from the regular like books and stationery was coaching support while the children were in the CCI. We now plan to extend it to the children who have gone home, initially through the phone by connecting the coaching tutor with them, and later on creating a community initiative at the community level, getting together with the community to involve them and have some coaching facility at the community, which the community owns, community runs. Later on, it becomes sustainable, but we help them to facilitate it and just start it. So that's one way. The third aspect of education, which is very important for us, is for every child in the higher class, from 9th class onwards, we have insisted and always helped them with the aptitude testing and career counseling. This helps a child to know, where they are, and how he or she can take the education forward. So for that, again, we are going to use the remote way of working. So the psychologists who give the psychological test and analyze and discuss would happen on the remote. That's something that we would continue to do. The only activity which currently may not happen as part of education is all the children were part of a computer education learning program. And that was obviously into the community at the computer lab at their own CCIs. So we will figure out how we are going to do that. We have not yet really looked at it because that's not an immediate thing. Right now, the schools are closed. So as such, education is not being missed. But yes, certainly, we are keeping them engaged with these other activities or staying connected with them. And also trying to find out what their own schools would do if they're going to remain at home and study. And there are already plans in many states. I have spoken with a lot of people in Tamil Nadu and other states where there are plans and very soon they would roll out. So we would be happy to part of that and help these children. For us, education is one of the topmost priorities. We would support the child till that child finishes his or her education at the top level, whatever choice he or she may have made. That's a commitment that Miracle Foundation does with the orphan and vulnerable children with whom it works. So we would not go away from it even when the children have gone home. We would continue to work with them on that.
With respect to the coronavirus pandemic, are you also running some awareness programs in rural areas to educate the families how to maintain sanitation, how to disinfect themselves, or how to even understand to screen their symptoms should they feel any?
So no, we are not doing it directly, but we work through our partners, all these CCI partners. So they have, we worked with them. UNICEF and Government of India shared a lot of guidelines for it, which you have shared with them. Our team has painstakingly sat with the staff of the CCIs to orient them, educate them. And they have done a wonderful job of taking it forward. For example, if a family has come to pick up the child and take back, an hour and a half long session has been held to educate them on how they would do it. Right now, there isn't much movement because everywhere there's a lockdown. So people are not, even the CCI staff is not able to go to the villages to do these awareness programs. And of course, there are equal number of children on board, even now in the CCIs. They haven't gone back home. For example, in Maharashtra CCIs, the children are there, but they're monitored. Every morning, they're supposed to send a health report to the state government on that. We're also encouraging them to keep those children engaged with various activities. A lot of corporates have come forward and their employees are volunteering to virtual activities with these children of various kinds. Because these children who are in CCIs are also facing anxiety. What could my parents be doing outside? Are they getting anything to eat? If there are no parents, relatives, what's the situation? There is an overload of information which is coming from all over. So the CCIs are trying to restrict it. But at the same time, keeping these children engaged with routine activities is the key to this. So that is how we are helping across everywhere. Unfortunately, it's Supreme Court has really, given good guidelines, a judgment on how to, work with the children who have gone home, or those who want to go home, or who are continuing to stay in the CCI. And I think those are really phenomenal, and every CCI and every organization should follow it. We are encouraging and guiding our partners to follow that for this. That's how we look at it.
Right. I think the center has also acknowledged the efforts that have been provided by all the NGOs at the national level, especially at a discussion with the Supreme Court, I remember of recently.
Yes.
How do you view the role of NGOs? I mean, there was this recent data analysis done by India Today, published on April 9th. It said that in 13 states and union territories, NGOs outperformed state governments in providing humanitarian relief. Some of the data that really struck me was Gujarat. In Gujarat, NGOs fed 93% of the people, and in Andhra, the figure was 92%. So, how do you view the role of NGOs in a developing economy as India, and especially in these difficult times?
Certainly, and NGOs are always supporting, to the government programs or government initiatives. So NGOs perhaps started the work earlier than the government did. Government does have a relief package. They have rolled it out, but it's a mammoth program. They really have to reach each state, each village to the PDS, give that support. So in some places it has taken time. But in the meanwhile, I think NGOs really came forward and took the entire matter in their own hands, took it forward. There are most of the NGOs who are credible. I think the donors have always been with them. So, supporting these NGOs, but, getting support from the donors wasn't a problem, because I think the donors who are long-term donors, for example, our donors, knew that we are sincere, honest, and if they're donating something, we are really going to, utilize it, judiciously. So I see NGO's role as supporting to the government, taking it forward. You're right that the NGOs did begin the work much earlier. And I think that's why in many places, I think we averted, say, basic problems of, hunger and something. At least the problem is huge. I can't say that NGOs could have done everything, but NGOs like us, we want to do it and we are at it. As I told you earlier, currently we were looking at supporting these families for 2 months. But then when we started interacting, we realized in 2 months, this problem is not going forward. We might perhaps be wanting, we will perhaps work with them, who knows, 3 to 6 months. And that's where we require the support, of the government and of the donors, both of them.
Right. Talking of government's role, you've been working in the welfare and development sector for, I think, over 3 decades now. With your experience of policy implementation, how effectively has the Indian government handled the twin crisis of lockdown and coronavirus?
I think, I can speak for the kind of work that we do and not generalize it. I think there have been really good guidelines which came pretty quickly. As I told you, the government or the Supreme Court judgment, which is really very helpful for this. State governments, of course, immediately share these guidelines and Supreme Court judgments everywhere. They have set up their own interventions and how they're going to monitor the situation. They have their own support system and the packages which they are rolling out, because each of these women and child does have some schemes for the children, which are coming useful now. And all this is certainly going to be a great support to these families. So they do have, and government has rolled out the schemes because it gets announced and rolled out by the central government, but ultimately it's the state governments who actually implement it. And I think there has been a good supportive, proactive role by the state governments in this.
And how do you see the interaction of the state and center with regards to aid and relief packages? Has there been enough cooperation between center and state?
I can only comment on what I read in the newspapers, on the website. So I wouldn't like to, because there could be some gaps in that, but in some places in rural areas, the families have shared with us that, the relief has not come, or relief is not sufficient, or whatever they're supposed to get is not coming through. But these could be distribution problems as I see them. So I wouldn't say that it's a coordination problem as such. It could be just, some procurement, supply and distribution problem as I see it. I hope the state and the central government really coordinate and make this happen in the best way possible.
So the reason I bring up that particular topic is a recent survey done by stranded workers Action Network, and this was in collaboration with Aziz Premji University, published April 15th. This highlighted that 89% of the workers did not receive wages as part of the relief package announced on March 26. 96% workers did not receive ration as part of the USP, and 70% have not even received cooked food. And this is despite the credible work that NGOs have been doing proactively, in fact. So how do you view the manner in which both state and even the central government have responded to the plight of migrant workers?
So as I said, Mudit, there could be, these are some of the things which at the state or central level, I think coordination and distribution of these responsibilities and these relief packages, this is how one needs to see it. Because, for example, I take an example of Delhi, where there are migrants and there is cooked food being distributed, yet people were complaining that they got less food or they had to wait 5 hours. So all this points to perhaps, there's somewhere, a lack of maintaining a balance between how many people really need it and what are you actually giving it. So that estimation perhaps may not have been correct, but people did not really realize, the authorities did not realize how much they need to do it at that time. That could be one reason, as I see it. So that's the, I had also read this report. And yes, in many places it is true. It is true because I have, heard this from many people who are in the daily wages, from Gurgaon, from Delhi, from Pune, that they have faced this problem. It's there. One cannot deny that. Many have suffered in that.
So do you think it is time for a second relief package? The first one came, I think, over 35 days back.
Yes.
First, how do you view that relief package? And do you think it's time for maybe another relief package?
I think government will have to continue to support for some time till these people get into some kind of an employment or wage earning. Otherwise, how are they going to sustain themselves? So yes, I think a relief package is required, and I hope it's quick and it's reliable. It's authentic. That would really work well. We are in this as a country. It's a long haul. We are going to be there for a long time. And I think government also knows it. We have to look at it that employment to everybody is not going to be overnight. It's going to take time. And that's how it should be. I have done some work earlier in the, various disasters where initially you give them a relief and then you support them so that they are able to sustain themselves and settle down. So with that, I think government has to, I'm sure government is already working on that.
What kind of social reforms do you think we require as a diverse society?
Well, I think there's a lot of, we have to believe in the people power, we have to involve people. A lot of solutions lie in the hands of the people. The people like to do that. And this is, a principle that we as, in this field of social work or social development believe, that help the people to help themselves. That's the principle that we go by. That, help them, trust them, and allow them to take forward, work on their own problems. And there are enough examples of this in our country in pockets where this has happened. I think that's what needs to be focused on. And I'm not saying that government is not focusing on it. Government does. There are enough examples of it where there has been models of it also.
Okay. And my last question, and then we've move on with things. How do you view the post COVID-19 scenario in India? Do you see a lot of social change in how we, sort of employ these migrant laborers? Do you see them coming into a more formal economic category, shift in, social values, how we interact with each other?
It's too early for me to talk about it, or, perhaps, I may not be an expert to talk about it, but there could be a shift in it. There would be, definitely. I can speak for the children with whom we are working.
Sure.
Families. Definitely. I can see that, the way these families earlier were, ready to send these children to the childcare institutions, wanting free education and free support. But if the families are supported for this, while the child stays with the family, I see this as a big shift. That the families stay together. That's the first right of the family, according to the United Nations Convention of Rights of the Child. That every child has a right to family, so they stay together, strengthen the family, strengthen the community structure. Have adequate child protection systems in place, and let the children continue their education, and the government and the non-government continues to support this family. I certainly see and envisage this shift. This is how we would like to do it. Miracle Foundation India, dreams that every child has a family. And for that, we see this as an opportunity to take it forward. And there are families who have come forward because they want their children to stay with them. That is how they look at it.
Right. Thank you so much for this candid interview, Ms. Nivedita DasGupta.
Thank you so much.
It was a pleasure speaking with you. Thank you.
Thank you so much.